When you're looking for cheap hair transplants, I'll ask you, what part of that entire process do you want to cut out? Do you want to have the staff not use microscopes? Do you want to have an inexperienced staff? Want to have a doctor that's doing noses on Monday, breasts on Tuesday, and maybe every other Wednesday he does some hair transplants? Don't sign me up for that. That's not what I'm into this for. I want a doctor who's going to deliver the results because I only have so much donor hair. Prices are going to vary, of course, as in anything. We always talk about the doctors that I personally like to align myself with, and there's a cheat sheet checklist that they need to pass in regards to a criteria. We've gone over this before. Board certified. These are specialists. They only do hair restoration. That is how they make their living. They've been doing it for at least 5 years. They've gone through a fellowship program. They have enough videos and photos for you, the consumer, to take a look at and can tell that they're really good at what they do. Plus, I'm here as a resource as well to help you in decisions around the country and some outside the country in choosing a hair restoration specialist. So I'm a pretty frugal guy. I'm not really a car guy, but I don't like to pay a lot of money for anything. I think sometimes it's a waste. What I will tell you is that the actual procedure of a hair transplantation, hair restoration procedure involves a lot of labor if it's done properly. There's no shortcuts involved. It will take time to do your procedure. Most procedures, most doctors and clinics are going to start early. You're going to start as early as 7 o'clock in the morning. And depending upon the size of your case, it's going to take until about 3:30, 4 o'clock in the afternoon. Facial restoration can take up to 14 hours to do all the work. It's just much more labor intensive than the scalp. Most of the excellent doctors in the country and the world will charge you by the graft. And each one of those grafts is very, very special to the final result of your hair restoration procedure. The techniques that are involved in whether it's the extraction of an FUT procedure, you need to be a really good surgeon. I've had many doctor friends tell me there's no such thing as minor surgery. There's just minor surgeons. So what you're paying for is the excellence and expertise of a doctor that knows how to take a strip. Think about it. The grafts are laying on top of a sebaceous gland. So it's a little bit like a lasagna with the layers that you make when you're ready to bake. The doctor has to literally lift the tissue and he has to have all the sebaceous gland intact without going too deep into the main veins and arteries or going too deep into the tissue itself, which can be painful post-operatively. Doctors like Dr. McGrath was a general surgeon for 12 years before he got in hair restoration. So his residency was general surgery. He was a surgeon and he's absolutely a really good surgeon. For him to do an excision or a strip procedure, it takes about 25 minutes. The grafts come out perfect. The actual tissue comes out and just lifts right out. This is what he's been doing for 20 years. And it doesn't go into the deep tissue where you're gonna have that deep tissue wound and pain and bleeding. The FUE procedures are more difficult than we would want to think. What we're doing is we're going in and coring out the grafts one at a time. And it's not as easy as it looks. So depending upon the surgeon and what he or she chooses as a tool to extract the grafts, will also determine how long it takes for them to extract. Let's say 2,500 grafts, a really good surgeon in hair restoration right now that's been doing FUE for at least 10 years, probably take them a couple hours to get the grafts out versus 25 minutes for a strip. So that's just the beginning of the procedure. The tissue is then passed over to the technicians. The technicians who are highly skilled and trained by the doctor and have years of experience behind them are now going under high magnification using microscopes to dissect that tissue and trim that tissue so that when it's dense packed, it can be placed very close together. This is the second part of a very labor-intensive procedure. At the same time, or halfway through that, the doctor is then using his techniques to create the angle and direction in a three-dimensional space, creating the sites, which is a fancy word for holes, using very fine instrumentation, where he needs to use his skill set to get that hair as dense as possible, but at the same time, all of it needs to grow. So it's kind of a 6 in one, half dozen the other. They need to get them really close, but if they get them too close, they won't grow. They'll fight for blood and they'll die off in new growth. So it's not as easy as it seems in that regard. After that is done, the staff and the nurses have to then place that tissue like threading needles, one needle at a time. You usually have one person on one side, one staff on the other side. And if you've got a lot of hair loss, if you're bald and you have crown issues, there'll be someone in the back as well. The doctor makes the site in a three-dimensional space. So the only way that the graft can go in is in one way. So they're going to do it fast enough so that it doesn't take till midnight that day, but take their time so that it's all done perfect. So there's a lot of labor. There's a lot of technique. It's 50% science, 50% art. And of course, you as a consumer, you as a patient have to judge based on photos, videos, your consultation with the doctor, and if you feel his skill set matches your needs. So the average procedure, I would say, for a 2,000 graft procedure, of the top doctors in the country, depending upon which city you live or where you go, could be anywhere from $10,000 to $15,000 for a 2,000 graft case. In my world, that's not cheap. It's probably not cheap in yours either, but if it's done right and it comes out as promised, it'll be the best investment you've ever made. And I've heard that over and over from many patients, which every time I hear it makes my day. You can't afford a cheap hair transplant. You may say to me, well, Steve, I only have $5,000. That's it. And I need to get this done. So I'm willing to take the chance. Really? You're not willing to take this chance because the problem is not the money. The problem is that it isn't that you may not be happy with your result. Well, that's a problem. The problem is that half of your donor hair is going to be destroyed by an inexperienced doctor and inexperienced staff that does this part-time. A lot of these clinics, and I never name names, that buy a machine, that are sold a machine by a machine company, and they tell them that this is easy. They don't even know what they're doing. They bring in a technician who travels and gets paid $1 a graft. So you're paying, let's say, $3 a graft or $4 a graft. That technician says you can use 3,000 grafts. They make $3,000 for the day. And that doctor who's in the other room doing a different kind of procedure just made $5,000 or $6,000, and everybody's happy. Except you when you see the result. There's an old saying, friends of mine used to be in the stock business years ago, and they'd say, hey, we just made a trade. They'd say, let's see, I made money, the firm made money, 2 out of 3 ain't bad. That doesn't work for me. I'm always looking out for you. You don't want to go after a cheap hair transplant. You can't afford a cheap hair transplant. Don't forget to like and subscribe to the McGrath Medical YouTube channel.